I'm a dentist, and since 2005, I've been in charge of the Aesthetic Center in Polonice-Zdrój. In my work, I concentrate mainly on treatment within cosmetic dentistry and endodontics. Preparatory procedures and prosthetic treatment are also important in the process of achieving long-lasting functional and aesthetic effects. During these procedures, I often use the Smart-M dual-wavelength diode laser, the 6-in-1 model by Lasertronics. I especially use the photoactive disinfection mode, as well as the functions meant for surgical procedures. Photoactive disinfection in endodontics is a procedure aimed at complete elimination of bacteria, viruses, fungi, and their endospores from the root canal system of teeth, as well as from periapical tissues. The relatively simple procedure significantly increases the effectiveness of endodontic treatment, especially in difficult clinical cases in which some microorganisms demonstrate high resistance to conventional methods of root canal disinfection. Vivident Optradam screens make it easier to work. They enable greater access to the treatment area and protect the lips and cheeks from accidental mechanical damage. Additionally, they reduce the tension of the patient's mandibular muscles, which in turn make treatment more comfortable. For quick and effective anesthesia of the lower molar teeth, we apply transcortical technique with the application of the Quick Sleeper 3 device. A small amount, only about 0.8 milliliters, of 4% articaine with addition of 1 to 200,000 concentration adrenaline produces an effect of complete anesthesia of a single tooth for about 40 minutes, without additional symptoms such as paralysis of the corner of the mouth, of the tongue, or cheek. Before root canal treatment could begin, the tooth was prepared appropriately by replacing old fillings and restoring the tooth to the stage of simple cavity. After that, the tooth was secured with Thermex Sem, photo-cured Comprimier cement. After placing the rubber dam, we begin the procedure of restoring the patency of root canals and the root canal system extension. The procedure presented was performed with the application of a step-back mechanical technique with preliminary extension using the VDW FlexMaster tools. After using each tool, the canal is washed with 5.2% Chlorax by turns with citric acid and EDTA, file care, preparation. The final surface size of the preparation of 4 canals is 35 by 04 according to the ISO standard, plus facilitating widening of apical foramina with an introfile tool. The minimal canal widening size is such that will allow us to insert the endodontic needle easily along the entire working length of the root canal. Canals prepared in such a way are then washed for the last time, for example with isopropanol, and drying is done with sterile paper points. Application of toluidine blue, a needle on a syringe is inserted to the full working length, that is 0.5 to 1 millimeter before the periapical area. The procedure facilitates the use of the endometer, which will allow us to precisely determine the depth of the needle insertion. After depositing the liquid in each of the canals, it is necessary to wait for 60 seconds, letting the preparation reach the bacteria present in the canals. Before applying the laser, putting special protective glasses on is required, which will protect the eyes from the radiation from the 635 nanometer laser beam. We introduce into the canals, thus prepared a suitable laser tip designed for photoactive disinfection of root canals. Each canal is treated with laser light for 30 to 60 seconds. The tip is placed at the full working length. After photoactive disinfection is finished, we remove the overreacted liquid from the canals with sterile saline solution, distilled water, or isopropyl alcohol. We dry the canals with sterile paper points and then fill them with gutta percha with sealer using the technique of warm vertical condensation. After checking the filling with a microscope, a dental radiography check has to be performed in order to verify the tightness of the canal filling, and especially of the periapical areas of individual roots. After completing the procedure, the tooth is once again secured with the Thermax SEM temporary photocured cement. It is a simple and quick way of securing the tooth for the period before the final dental crown reconstruction.